great to have you with us on Pharmacy News, and I'm delighted to say that Robert Reid joins me now, CEO of MedAdvisor. Great to have you with us.
Great to be here.
Now, you have some exciting news for us today. Can you tell me a little bit about GP Link?
Yeah, so GP Link is a major step forward for us in what we're trying to do with patients and make sure that they have the medications that they need when they need it. And MedAdvisor is a platform that helps remind people to take their medication safely, effectively and on time.
Right.
And we remind people to go and see their doctor as the product stands now when their scripts are running out. What GP Link will do for both the patient and the industry is give them a tool to be able to request a repeat authorisation from their favourite GP, and that favourite GP will also have an ability to see the adherence profile of that patient over an extended period of time. So it's a major step forward in creating what we call a medical home, and that's having one pharmacist, one GP,
Yes.
one patient all looking after the health outcomes.
And that is your ultimate goal, isn't it?
Absolutely. And so we're really excited to have developed the technology to be able to do that, and we'll be launching that in the first phase of the pilot over the next few weeks.
Fantastic. Now, some other exciting news came from the Minister today.
Yes, we're really excited to hear what the Minister had to say about partnering with digital and app developers to make healthcare much more connected to the patient and give consumers more choice about the type of intervention that they have. They've announced I think it was $50 million worth of funding for pharmacy trials that will incorporate medication management, medication adherence programs and connected health platforms. So we're tremendously excited about what that could mean for MedAdvisor and for the health community more broadly.
Absolutely, and another an important partnership was announced today.
Indeed, yes. We announced our partnership with Epilepsy Queensland, and for us these types of partnerships are really important because they can help patients get better with the medication that they're meant to take. With epilepsy, obviously, taking medication is a really important part of their regime, and I must admit I was a bit shocked to find out that the average compliance or adherence to medication for epileptics is in the order of 55%. So
Really?
They're not taking the medication that they should be. With MedAdvisor patients, they're about 21% more adherent than the rest of the population, our epileptic patients. So
Wow.
that's a very important thing for Epilepsy Queensland, to be able to help promote MedAdvisor and make sure that their patients are getting their medication and taking their medication on time.
Absolutely. Now, your session touches on customer loyalty, and I was quite surprised to learn that it's only 1 in 4 patients. They don't know which pharmacy they're actually going to go to.
It's quite amazing, isn't it? And we talk to a lot of pharmacists who tell us, my patients are loyal because I've got scripts on file.
Yes.
But what they don't realise is they might have 3 scripts on file, but that same patient's got one with a discounter and one with a pharmacy close to work.
Yes.
And what we've been able to identify is that there's a real opportunity using technology to be able to create more loyalty inside the pharmacy. And the MedAdvisor platform gives patients a tool to be able to see all their scripts on file, all their current medications, when they're running out, what their supply is, and get all their reminders. And what we notice across our 130,000 customers is that they start to move all their scripts to one pharmacy so that they can see it all on their one phone. And that's creating an average loyalty across our whole database of 97% to that pharmacy. But what we learnt in our session was that there's a distinction between behavioural loyalty and attitudinal loyalty.
Yeah.
And attitudinal loyalty is where people are choosing to go to a pharmacy because they're getting better service and better choice rather than it's convenient. It's on the way home or it's close to work.
Sure.
I'm going there because they look after me when I go in there. And tools like MedAdvisor that have a tap to refill function mean that people can streamline their workflow. So they get all their script requests in overnight or during the day, and they can handle them at times that are not peak periods, which means that when that patient comes in, firstly, they don't have to wait, and secondly, the pharmacist can engage with them on a much deeper level about their health.
Wonderful. They have the backstory, and obviously they have the time then, don't they?
Exactly.
Fantastic. That's very insightful, and I appreciate your time, Robert.
Pleasure.
Enjoy APP 2016.
Thank you very much.
Very exciting times. We'll be back with more pharmacy news shortly.